Overactive bladder is a chronic syndrome characterized by urgency with or without incontinence, as well as urinary frequency. Overactive bladder is very common, actually. It happens in 1 in 6 people. It affects both men and women. However, it is more prevalent in our elderly population. Normal bladder function involves the coordination of our brain and the bladder muscle through nerve signals. So when there's a breakdown of this pathway and this communication, somebody can have overactive bladder. Essentially, the patient notices that they're having more urgency and frequency because the bladder's contracting much more than they want it to due to a breakdown of the communication between the brain and bladder muscle. Overactive bladder is diagnosed based off a patient's symptoms. So when a patient presents and they have symptoms of urgency and frequency as well as urgent incontinence, we'll tend to treat just based off symptoms alone. We do, however, need to perform a physical examination. We'll always check the urine for infection to rule out other causes. In cases where there is not a clear-cut history or it's not an obvious diagnosis, we do have other tools available to help us make the diagnosis. So overactive bladder is not preventable. However, there are several risks or factors that do make symptoms worse, such as certain foods and beverages like caffeine or obesity. The benefits of seeing a specialist for your overactive bladder symptoms is that they can provide you with the newest, the latest treatment options available. And this will include either simple treatments such as behavioral changes, medications, or the newest procedures that are available for overactive bladder. The care pathway for overactive bladder involves 3 different tiers. So the first tier is typically going to be our most conservative. It involves the least risky options. And this is going to be behavioral modification, which includes bladder training, timed voiding, avoiding bladder irritants, watching your fluid intake. The second tier would be medications. So these are going to be anticholinergics and beta agonists. These medications should give you more time to get to the restroom, less urgency and less frequency. The third tier are our most invasive options, and that's going to include everything from neuromodulation, which involves peripheral tibial nerve stimulation as well as sacral neuromodulation. And the third option is intravesical Botox injections. Every treatment is different and every patient's goals of treatment are different. So really what works for one patient may not work for another. For example, some patients really want a quick fix. So maybe they're gonna skip over some of the second tier options and they're gonna want an InterStim evaluation right away. Some other patients don't want to have anything invasive done, so they're going to choose something more conservative. So really, I choose my treatments based on the patient's goals for treatment. Satisfaction rates really do vary. Overall, medications tend to have a lower satisfaction rate, and that may have something to do with patients not being able to take a medication in the long term. We do see that satisfaction rates are higher for our third tier options, including InterStim. There usually aren't any dangerous long-term consequences of having OAB or overactive bladder, but really what it does affect is a patient's quality of life. So in somebody who's really lived with these issues for a long time, there tends to be a big burden on their social life. And that includes, dealing with embarrassment, shame, inability to leave their house due to the severity of their symptoms. So overall, it's a burden on your quality of life in the long term. What I really try to emphasize with my patients is that overactive bladder, it's not dangerous, but it really does affect your quality of life. And really, there are some really good treatment options out there. So I encourage patients to seek out a specialist to address these issues because it's not a normal part of aging, which tends to be a lot of what my patients think, and it truly isn't. And don't get discouraged because if one treatment doesn't work for you, there are so many options that usually we can find something that will make your symptoms better and improve your quality of life.